Good afternoon. First of all, I again also want to thank all the members who are participating in this. And we're going to talk about behavioral health into the future. Next slide, please. There are many post-COVID challenges. Working with the member hospitals that you all do, you know them, you live those every day. But to name a few of the behavioral health specific challenges, we know that 40% of adults reported a significant behavioral health problem in a study that was done in June 2020. The prevalence of symptoms of specific anxiety disorders, depression, increased incredibly. Anxiety alone went up approximately 3 times from what was reported in 2019. We already talked about suicidal ideation and attempts with many of my colleagues. This is all being increased by the US behavioral health crisis, and it's fueling up to $140 billion in added spending and countless suffering. Tammy talked about children. Just today, this morning, I read a quote from Children's Hospital of Colorado, and they were reporting a 90% increase in demand of behavioral health treatment now compared to what it was. And they said there's many weeks where their number one emergency department visit is because of a suicide attempt. That is just staggering to even think about. There's many disruptions in care due to the pandemic. We're very well aware of that. Next slide, please. But let's get a little hopeful and talk about moving into the future. I think one of the really important things, and going back to talk about the members webinar that Vizient sponsored recently, and a lot of it was talking about rising up, I would encourage and challenge all of us, every member that's on the phone or other members that you work with in your organizations, to think and talk and make plans for how we can rise up as healthcare providers to do better. Number one, the conversation's happening. When you turn on the television and Oprah and Prince Harry are talking about pretty significant private mental health problems, that's a change for us in this country, and it's very positive. We really need to work to create a culture of support, really focus on whole person care. It's the right thing to do, but it's also the right thing financially, because we know that in a population that is seriously and persistently mentally ill, for those of your organizations, the member organizations that are in fact either dove in or dipping a toe into population health, we know that the biggest spend in that population is actually the medical spend. And so whole person care makes sense for all kinds of reasons. We've already touched on telehealth. There have been many changes in policy and payment, and changes in who can qualify and who can provide the services. Hopefully none of those dials get turned back again. There's an app now, it's incredible. It's called Brightside, and it's actually for consumers. And it is actually supposed to help manage your symptoms for anxiety and depression. There's been a 50% increase in new users from the early pandemic to now. That's great. We talked about policy changes. There's a lot happening, which is very exciting to me, working in the behavioral health field, which I care passionately about. One is 2 women wrote A Path Forward: Mental Health and the United States Pandemic Response. The 2 women are pretty incredible. One, Shirlane McCrae, is the First Lady of Washington, D.C., and Linda Rosenberg was a past president for the National Council on Behavioral Health. A lot of that was building on the Affordable Care Act and mental health parity and taking it further. Next slide, please. There's a lot of opportunities for all of us beyond healthcare providers and the members on this webinar. Employers, one study showed that 68% of employers plan to increase their emphasis on behavioral health within the next 2 years. So there was a defined period. That's fabulous. There's real opportunity for us to use population health affecting mental health policy to aim to really promote healing and wellness broadly for vulnerable populations. Next slide, please. Transformation of the data sharing environment. Huge opportunity there. I was mental health commissioner at one point in the state of Arkansas working on behavioral health reform. And one of the biggest things, and this is happening in every state in the country, was talking about the data sharing environment, because it's really hard to say you're going to have whole person care if the systems can't talk to each other. But there's a lot happening. California, for example, has published guidelines to promote effective sharing of behavioral health data. That's just one example. Other states are working on their data infrastructures as part of healthcare reform and patient-centered health homes. CMS and a lot of those have requirements, in fact, for a lot of that. Really empowering consumers. Stigma seems to finally be moving in a direction that's different. We know that ages 26 and above, about 35% of that population is seeing some type of a behavioral health professional, while 18 to 25, very different generation, self-reported 60%. Next slide, please. There are huge technology opportunities. I'm just going to run through a few, but of course you can go in and research any of these. Virtual assistants. So there are chat bots. I didn't even know what a chat bot was when I started researching this, and emotion-based algorithms to provide psychological support directly to people. One is called Tess, and it's actually a mental health chat bot that provides coping strategies for people suffering with some kind of a behavioral health problem. There are digital consumer experience technologies. These are platforms that manage the patient relationship and monitor and exchange information between patients and caregivers, and then connect the patients to specific tools. One is called NeuroFlow, and it actually is a suite of tools that enables remote monitoring and behavioral health integration across continuums of care. There's all kinds of diagnostic support screening tools. One is called Unmind, and it's a workplace mental health platform that empowers organizations and employees to measurably change, whether it's their anxiety or how they're, feeling in another negative way. Next slide, please. Digital phenotyping. This is really customized treatment, monitoring, and clinical decisions for new biomarkers by wearable devices. One is called Abilify MySight, and it's actually a prescription of a tablet with an ingestible event marker sensor inside. I mean, it sounds real sci-fi, but these things are tools that are out there now. All kinds of neurological interventions. One is WVU Medicine, who I have to give a shout out. Our chief medical officer was the chief of psychiatry there. Not why I'm mentioning it, by the way. It's pretty cool. They have a clinical trial with deep brain stimulation for treatment-resistant opioid disorders. And we know that opioid disorders are extremely, extremely difficult to treat. Physical, augmented, and virtual reality. These are interventions with hyper-realistic environments. One is called a calm place. I mean, who couldn't use that sometimes at the end of a work week in healthcare through COVID? Next slide. So before I hand this over to Pat, I want to tell a very 2-minute story. And I think to me, it really is enough reason for all of us to rise up and to be that voice in our organizations, that champion, that really challenges, encourages all of us to think about how we can do better in behavioral health. There's a young woman named Lauren at the very, very, very beginning of COVID, back when it was March, and it was first starting to spread in a lot of the states. She had a toddler at home, a wonderful young husband, and had given birth in a very well-respected medical facility. And she was running a fever. And that was back, if all of you members remember, when it was really hard to even get your hands on a COVID test, even as a provider. I mean, we even had some units that had to close for a while as we thought and really struggled with how could we all get our hands on COVID tests. Anyway, so they assumed she had COVID because of the symptoms and sent her home without a COVID test. And she wound up passing away within 24 hours. And it turned out she didn't have COVID. She had a uterine infection that could have been treated. The tie to mental health here is her young husband isolated A lot of family was out of the country, and the few family that were here really couldn't have access to help him. And so here he was now with a toddler and a newborn and a huge amount of financial burden aside from being heartbroken. And over the course of that next year, he really slid into a very deep depression and started experiencing pretty significant substance abuse problems that he had not ever had before. And it, I mean, he's alive. He wound up in one of our programs, and it was just a tragedy as we think back about how many lives have been touched in direct and indirect ways. So I'm going to turn it over to Pat now, but I guess, there is opportunity, and I think we all have a serious responsibility in healthcare to rise to the challenge. Thank you so much.